Ladies and gentlemen, good morning, and once again, welcome to this sunny morning in the United Arab Emirates. Now, this is our second DiaBeat webinar, and our topic is the diabetes diet. Now, as is my practice, prior to any webinar, I do a little reading on the subject that is being presented. Today's subject is the diabetes diet. And when I read up, it seemed simple enough. It simply said that the best diabetes plan is to simply eat the healthiest foods in moderate amounts, sticking to your regular meal timings. And that seems simple enough. However, when I read further, it said, avoid fried foods, sweet and fatty foods, sugar, white bread, sweetened cereal, aerated drinks, processed food, and many more such limitations. And when I wondered what I should eat, it said, eat leafy greens, beans, yogurt, and a few more such healthy foods. And then I wondered to myself, may I eat rice? Are potatoes good for me? What about a glycemic index? And I was as confused as any diabetic is. I realized then that perhaps one of the most confusing things in diabetes is simply what to eat. And my knowledge didn't take me further. It mentioned that the best diabetic diets, the most frequently practiced ones, include the standard diets of the Mediterranean diet or the DASH diet, the vegetarian diet, the Ornish diet. But what exactly are these diets? I thought to myself, we have done the right thing. We have correctly invited Ms. Ruba, the RAC Hospital's head of dietetics, the Department of Dietary, to talk to us on this subject today. Now, Ruba is a professional health coach, and that goes beyond dieting. However, as far as dietary is concerned, she specializes in therapeutic diets and covers the entire spectrum of inpatients, outpatients, patients with cardiovascular diseases, hyperlipidemia, digestive disorders, post-surgery. She does dietary coaching for weight management, sport nutrition, and closer to our subject, endocrine disorders, including diabetes. She is a member of the American Academy of Nutrition and Dietetics, the Arab Nutrition Association, the UAE Nutrition Association, the Emirates Medical Association, and so on. I'm absolutely confident that we have made the right choice in asking the simple question, Ruba ma'am, I am diabetic. What should I eat? What should I avoid? Ladies and gentlemen, I present to you a knowledgeable individual in the space of dietetics, Ms. Ruba Elhourani.
Hello everyone, and good afternoon. And thank you, Doctor, for this lovely introduction. Without any delays, I'll be taking you forward, and I will start sharing my screen so we can start our session about diabetes diet. So as you know, this diet, it's not only, let's say, the diet in general, it's a concept that majority of people think that it should be just a matter of time, but it's not. The way that you should think should be definitely changed so it can start affecting your lifestyle in general positively, and you will adapt better lifestyle and better and overall eating habits. So what we are going to see today is the difference between diabetic diet itself among type 1 and type 2. As majority of people, they don't know that there is a few things that makes these two types different. The role of carbohydrates and other macronutrients in meal planning and glucose control. I'll be going also into further explanation about the concept of consistent carbohydrate diet and the use of carbohydrate counting and what does it mean. And then to identify any other diet modification to address any complications or as an outcome of uncontrolled blood sugar. So what is diabetic diet? What do I mean by diabetic diet? It could be as simple as eating healthiest food in moderated amount, but also being consistent in the timing between the meals, and which is the most important point in following a diabetic diet. It is a healthy eating pattern that actually rich in nutrients, but still limiting the amount of fat and calories. And the key elements, it will be focusing on healthy sugar, fruits, high fiber food, whole grains, vegetables. And we can differentiate at the end of this session, hopefully, between what are the food that are highest in fiber and what are the foods that are higher in sugar that actually influence our blood sugar. And as we know, embracing your healthy eating plan, it is the best way to keep the blood glucose levels under control and prevent any further complications. Simple complications from high blood sugar or prolonged higher readings, we know that kidneys can be affected, our vision could be affected, as well as our weight, could be also influence of developing cardiac diseases and so many other complications. That's why we need to make sure that we are consistent in our medication, plus following a proper diabetic diet that is suitable for our needs and suitable for our bodies. And if it is needed, losing weight will make a huge impact on blood sugar. Aside from managing diabetes, diabetic diet also, it has other outcomes and other benefits. Because diabetes diets recommend generous amounts of fruits and vegetables and specifically fiber. Following it, it's likely has an impact on reduction of risk of cardiovascular disease and certain types of cancer based on recent studies. Also, consumption of low-fat dairy products can reduce the risk of bone mass or any bone diseases in the future. So talking about type 1 diabetes diet, basically we know that majority of people who are diabetic with type 1, they are on insulin regimen. And actually this is quite different from type 2, although certain people with type 2 also are insulin. But why it is very important to understand this concept, because the insulin injections and insulin treatment is directly related to the amount of carbohydrates that we are taking or consuming. So the importance of understanding the link between carbohydrate and insulin is to be able to coordinate the meal plan according to the dose of the treatment, using the amount of carbohydrate and calculating the proper amounts that with each meal based on the dose. So for example, if an insulin, it depends on the resistance of the patient. A unit of insulin can cover a serving of carbohydrate. A serving, it means around 15 grams of carbohydrate, and I will be explaining it later on. And altering the intake as needed, also if the intake is higher or lower, and also it depends on the blood sugar. So if the readings were higher or were lower, we can tailor our intake accordingly instead of keep just correcting the insulin dose every time. So being consistent in the diet and the amount of carbohydrate that we are recommended to take as per our insulin dose, plus knowing the type of food that is suitable when we have higher readings or lower readings. It's very valuable and very important in type 1. We can also look into how we can increase our intake, reduce our intake according to our activity level from carbohydrates. And then, of course, we need to link it and reduce the risk of having episodes of low blood sugar. So how do we usually avoid such episodes? It's by being consistent in having proper amount of carbohydrates as needed. Talking about type 2 diabetes, majority of the patients are actually with overweight body mass index or are actually obese. Some of them might be on insulin, but other majority will be on oral medication or just lifestyle control. So the concept will be focusing on controlling the excess body weight or losing the extra weight, and to understand the amount of carbohydrates overall needed throughout the day. And this actually depends on the gender, depends on so many other factors, including the body mass index. It depends on the level, activity level, on the preferences, on the culture. So we have to look into the overall picture, not focusing on one only picture. And if the patient is being treated with one insulin or any other injectable medication, we need also to be careful about the amount of carbohydrate that we consume to maximize the benefit of the diet following the diabetic diet. And overall, it will eventually help in reduction of the risk of having any other diseases. So what is carbohydrate? Carbohydrate, we know that there is macronutrients called carbohydrates, proteins, and fats, and these are the major sources of energy for our bodies. But mainly we get influenced, or our blood sugar is mainly get influenced by carbohydrates. Why? Because it is digested very quickly. It takes just 15 minutes to 2 hours and has a direct effect on the postprandial blood glucose levels. So the more sugar we eat, the higher glucose we will end up with. And it should also provide around 50% of our energy intake or daily dose. And this can differ again according to several factors. If the patient is male, he will require more calories, more carbohydrates. If he is exercising or having more activity levels. A pregnant woman, for example, with gestational diabetes, which is another type of blood sugar. So where can we mainly find carbohydrates? Any kind of grains, any kinds of pulses, beans, starchy vegetables, like potatoes, corn, carrots, any root vegetables, and dairy, fruits, sweets, and in sugar. This is all considered as carbohydrates. And this is where we need to focus mainly, and we need to restrict the portions and the quantities and the calories as it's the main influence on our blood sugar. The other two macronutrients are the proteins and the fats. Protein digested more slowly. It takes it to 3 to 5 hours. The more protein we ingest, we have more feeling of satiety. It may help prevent between the meals and nocturnal hypoglycemia. And we can find it in both animal and non-animal products, such as meat, fish, poultry, nuts, peanuts, and etc. Now, talking about the fat, it has a big influence in making us feeling full. So it is very important to include at least 1 serving of fat to each main meal. Sources like the olive oil, like avocado, fatty fish, and it not only will prolong the satiety feeling, it will also prevent you know, the overconsumption of other types of food, and should be limited to less than 30% of our total energy intake. So a meal plan, when it comes to meal planning with diabetes, it is basically making a guide for your intake, when and what and how much to eat, and what are the nutrients that are we really needed to keep our blood sugar levels in the target range, okay? Not exceeding the range, the normal ranges. And it should also consider our goals, our tastes, our lifestyle, and any medicine that taken, as I've discussed, if it is insulin, non-insulin, or there is no any other medication. So also we need to make sure that the type of vegetables and type of food, it has higher fiber content. As we know, the starchy vegetables like beans or potatoes, they have higher calorie, higher carbohydrate content, so it can influence our blood sugar very quickly. Talking on the other side, which is the non-starchy vegetables, which also contain very high amount of fiber, like broccoli, like cauliflower, it doesn't have that high impact on blood sugar, which means it has a lower glycemic index. In other words, it takes it longer time to increase our blood sugar. So it is highly recommended to focus on such type of vegetables or other food groups, as it takes time for the body to have a lower reading. It takes it more time until we feel hungry again, and it also influences the blood sugar readings. And avoiding the processed food is very important. Talking about the fried cakes, cookies, it has so many bad influence on our body, not only on blood sugar, but yes, it is pure simple sugar and it should be avoided. The concept of having or following a diabetic diet is basically related to a method called carbohydrate counting. So basically, if you are diabetic, you need to be aware of the amount of carbohydrate you are consuming. Because as I explained earlier, it is the main factor on blood sugar. So first step is to identify the carbohydrate sources. What are the carbohydrates in this meal that I am going to consume, for example? Or what are the carbohydrate sources that I need to have on main meals? Second is to estimate or measure the portion sizes as I mentioned, depending on the quantity that you should be having, and it depends on how much calories and how much other factors affecting the person needs itself. Then to quantify the carbohydrate intake in the meal or the snack, and understand the serving or how many grams this food is giving us, explaining it in simpler way. Anything that we are having, except for the protein food groups, it contains carbohydrates. And this value varies among the quantity and the type of food. So let's say if we are going to have a cup of fruit, this is around 2 servings, because 1 cup of fruit contains around 2 servings of carbohydrates, which is 30 grams of carbohydrates. And you can always refer to the diabetic exchange list that I can share with you later on. You can find it on the American Diabetic Association, and it is called the Food or Carbohydrate Exchange List. So it will inform us or give us idea of any kind of food that is containing carbohydrates, what is the serving, and how much carbohydrate it will give us. So limiting the carbohydrate according to the calories and according to the amount of energy needed is very important. And this can be calculated and found by an expert or dietitian that can help you and give you an idea in the beginning, and later on it will become very easy for you and take it as a concept for later on. And there is totally no good carbs or bad carbs in this concept. So I cannot say that today I'm going to have fruit. It's a good carbs, so it's okay if I have more. No, because eventually it is again sugar, and eventually it is again going to contribute to your blood glucose level. So restricting and measuring the portion size according to your needs again has very important influence. Eating the carbs with food that have a protein and make it as a complete meal that contains these 3 food groups, the carbohydrates with proteins and fat or fiber, it slows down how quickly the blood sugar rises. So it's very important to focus specifically, especially on the main meals, the breakfast and lunch and dinner, that the meal contains all of the groups. So you will get your needs and you will get maximum benefit from out of it. Plus you will not have that influence on the blood sugar. So those who typically measure the blood sugar after the meal and it still gives a very high value, although the morning they have checked it and it was normal or regular or low, it's highly depending on other factors, of course, but it's highly also linked to that type of meal that they've had. So if they've had a fish with just green salad, it's not gonna be the same value of blood sugar if they've had French fries with fried fish. So keep it in your mind. The amount and the type of carbohydrate, it's very important. And then a very important factor in following a diabetic diet and calculating the carbohydrate is to make it consistent in each main meal. So overall, if your needs were around 150 grams of carbohydrate a day, it would be beneficial if you distribute it throughout the meals, rather than having the carbohydrate in 2 meals and skipping 3rd meal, or having a very low calorie meal or just protein a meal. So distributing it into 3 equal or almost equal amount in each meal has a very important or a very high good influence on the blood sugar. Counting the carbohydrates by using a plate method, also it is another way or an easier way to have a better estimate of the total amount of carbohydrate that you can take it. So a serving of carbohydrates, when I say a serving, it's like same thing with when I say one exchange, as I mentioned, it's equal to 15 grams of carbohydrates. Examples of that, like a slice of bread or half a bun or English muffin, half cup of potato or cooked cereals, 1/3 cup of rice or pasta. This is a serving. So when you are finishing around one full plate, imagine how much of rice, imagine how much carbohydrates you are consuming per meal. So this is how you need to be wise. And you need to be smart on making the better choices to have a better outcome on the blood sugar. Starting to 2010, we started following a concept that has been implemented by the American Dietetic Association, made it easier for the patient or for the person to understand or distribute the plate to equal or the food groups to make it more clear for them. The plate, it is actually a visual way to make sure that enough non-starchy vegetables and lean protein are there while limiting the amount of higher carbohydrates and that have highest impact on the blood sugar. So an example of my plate, diabetic my plate, will be, as you can see, you can just divide it to half and 2 quarters. One will be for the protein, regardless if it is from animal or non-animal sources. And then quarter will be for the carbohydrates, and half should be from the non-starchy vegetables. You can have any 0-calorie drink along with that, preferably water, but this is how it should be on your main meals. This is how your plate should be divided. So this is a very simple way to make sure that you are not exceeding the amount of each food group that you are supposed to have. Portion size and serving size are not the same. So you need to keep this in your mind. Portion size, it's the amount of food that you choose to eat at one time. But serving size, it's a specific amount of food, such as like 1 slice of bread, as I mentioned earlier, half cup of cooked cereals. This is what I mean by the exchange or serving size. So when you visit a dietitian, basically you will understand that when it is a certain amount of calories and carbohydrate are pointed to your needs, then you need to follow this specific amount of food following the concept of a serving. So if you are having needs of 150 grams of carbohydrates a day, this means it's around 10 servings or 7 servings of carbohydrates. So it will make it easier for you to know how much carbohydrates and limit the amount according to this method. And another way that makes it really simple for you is using your hands, okay? So a palm of the hand without the fingers, this is a serving of a protein, okay? If it is cheese or dairy, it is around 1 thumb or 1 full cup of low-fat dairy. What we concern more about is the fruits and the carbohydrates, which is around 1 fist, okay? It is 1/3 of cooked cup of rice or 1 medium fruit. This is called a serving or exchange. So we are applying this method in the diabetic diet to make it easier for you to follow the proper amount of carbohydrate that you need. So again, This is a further explanation. If someone is following 1200 calorie grams, it will be around 10 servings of carbohydrates if we are following the 50% carbohydrate intake of our total daily needs. Again, this is subject to change according to specific needs for each person. So this is just an example, but the proper amount will be calculated and by a dietitian or an expert physician. Around like the higher the calorie it is, the more serving that actually needed. So I'll leave this to answer for you to answer it and think about it as a question. So I'll give you as an example of generic 1,500 calorie diet for a just diabetic patient without any other morbidities. If he is following a 50% carbohydrate intake of the total calorie, he will end up with 12 to 13 carb servings, which is approximately around 180 grams per day. So distributing this within the day, it will be like around 4 servings in the breakfast, 3 carb servings on the lunch, and again 4 carbs. So we'll make it as close as possible. And we will leave around 15 grams of carbohydrate in the snack. And this way you will make sure that you are equally distributing the carbohydrates and making sure that you are not exceeding the amount that you needed. And if you follow that, okay, of course, the blood sugar with time, eventually it's gonna be stabilized, and eventually you will optimize a better outcome. Eventually, you will end up on lowering your blood sugar and the amount of your HbA1c or accumulated blood sugar, and eventually you will get a better control on your blood glucose level. One of the facts actually that you should know that if you are an overweight or you are obese, a weight loss of just 7 to 10% of the current weight can help lower the blood glucose level by around 1 to 3%. This is a huge amount. Helpful medication are also modifications like limiting the fat intake, avoiding unhealthy cooking methods, and optimizing your meal plan by adding more fiber, by switching to healthier methods, restricting the salt intake will all also, in general, end up in helping and influencing your blood sugar. As much as possible, you need to also exercise, keep it 5 to 7 days a week with a goal of minimum 150 minutes per week. But if you are aiming for weight loss, it should be 300 to 400 minutes in a week. And this has a very high impact on controlling the blood sugar. The higher fiber you take, okay, the more satiety you will feel. There will be slower carbohydrate digestion, and there will be definitely improvement in the postprandial glucose, at least 25 grams per day to 35 grams for female and male respectively. Limiting the fat intake up to 30%, from 27 to 30% of total calories. All patients with diabetes will protect themselves for developing any cardiac risk, specifically if there is a family history, genes, or they are obese. So they are on that category or zone. And they will eventually have a better control on their cholesterol and blood pressure as well. So what will happen if you are eating outside? Okay, and you want to make sure that you are still following the same concept, you need to visual the plate itself and make sure that you divide it into 2 halves. You finish the first half and leave the other half later on, or you just follow the my plate concept or method that eventually making sure that the plate has all the food groups and focusing more on the proteins and healthy fat rather than the carbohydrate. As you know, the more sugar you will have, the more cravings you will have. So you keep that in your mind. if possible at home, always measure the snacks. Try not to eat directly from the bag or scoop from the pan itself. Always make sure that you use your own plates, cups, according to the measurements that you want to follow, or you can use the scale to know how much carbohydrates or how much the full meal weighs, and then convert it into the exchange list concept. It doesn't mean that 50 grams of rice, it will give us 50 grams of carbohydrate. No, you need to be careful. This, the unit of the meal itself, it's different from exchange or the portion size list concept. So it's one serving will give you 15 grams. So what is again one serving of cooked rice? It's 1/3 of a cup. So this is what I mean. You have to know the serving size or the exchange list to be able to apply that to diabetic diet, and it will be really easy for you. But overall, the diabetic diet, it means less fat, more fiber, less sugar, and healthier or limiting the amount of carbohydrates according to your needs. And making sure that you are using or following a healthy cooking methods, that it will not require you to add more fats or more additives that may influence the blood sugar later on. Let nothing that can be treated by diet be treated by any other means. And this is your take-home message. And thank you all for listening. And I'll be happy to answer any questions if you have.
Ruba, thank you so much. Thank you so much. For our listeners, this is such a valuable presentation, and like all our presentations, it will remain on our site so that you can refer to it on a day-to-day basis if you so require. There is so much of information that Ruba has given us that you may want to refer to from time to time to get more clarity on what it is that you should eat in view of your diabetic situation. The presentation will remain on our site for you to refer to any time you choose during the next 3-month period for sure. Some valuable tips, besides the technical aspects, some valuable tips that Ruba has given us, many of which I, of course, will personally implement. Eat half your serving, which means that when you go out to a restaurant, you don't have to finish everything that you are served. A good rule, as Ruba mentions, is simply to eat half and leave the second half to eat for another day at home sometime. Ruba has also said that when it comes to weight loss, small steps. You don't have to achieve your total weight loss. Even a marginal weight loss of 5 or 10% is going to drop your blood sugar levels dramatically. And then, of course, the best advice of all, from my perspective, and I'm sure from Ruba's perspective also, she is a life coach and a health coach, and that is, do not forget your exercise. 30 minutes a day of walking or something moderate like that will be dramatically helpful. Now, Ruba, we've had many questions that have come up on our chat, and therefore I will quickly run into these questions. One question that has been asked is, what is the difference? Is there any difference per se, and you have answered this question, between what an insulin-dependent diabetic should eat as opposed to a non-insulin-dependent diabetic? That means an individual who is on insulin, is that individual's diet different? And if so, where is it different and how is it different from an individual who is not on insulin?
Okay, so I've explained it very simply, but I did not elaborate, as if I go forward in that, it will take a lot of, I need to explain a lot of details, but let me just clarify one thing. The difference that I mentioned, that majority of the patients, or if not all, type 1 are actually on insulin. Some of the patients on type 2, they may be on insulin. The difference between the way the diet is acting on them, it is directly related to the amount of insulin that they need. Because I mentioned earlier that 1 unit of insulin, it can cover a serving of carbohydrate. So the patient need to be more strict on calculating the carbohydrates per meal. So as we know, if a patient is on insulin, he will be having doses of insulin units amount per day before the short-acting insulin, before the meals. So this amount of insulin has to be calculated, or has to be inconsistent with the amount of carbohydrates. Let's say the patient is taking 3 units pre-meals. So this means that the patient has to take 3 servings of carbohydrates per meal. So this 3 units will cover 3 carbohydrate servings. Let's say the patient had more, then we can adjust accordingly after checking the blood sugar. So this is the difference. We are following strictly the amount of units that the patient is taking and how much his body is sensitive, because some patients the body may be more sensitive to the insulin, so they will require less carbohydrate, and others, they are completely opposite. So if the total amount of dose per day is, let's say, 10, so around 2 to 4 or 3 units per meal, it means 3 servings of carbohydrates after taking the insulin dose. As we know, the insulin is pre-meal. The other concept is carbohydrate counting, or it's actually the same. It applies also for type 2 diabetes, but the difference is they don't be strict of the amount of carbohydrates per meal because they are not on insulin. Let's say the patient is taking overall 100 grams per day of carbohydrate. It doesn't mean that exactly 20 on each meal, because there is no insulin. So he can take little bit more, little bit less on the main meal, for example, breakfast or lunch and dinner. And that's the only difference.
Thank you. Thank you, Ruba. That was very explanatory. Now, I have a question. I have 1 or 2 questions from Veena. The first question is about intermittent fasting, and she says it has become popular. What are its implications when it comes to an individual with diabetes?
Okay, so this is a very nice question, actually, because intermittent fasting, indeed, we know that it has very high influence and very great results on weight loss. However, if a patient with inconsistent blood sugar readings, diabetic patients, maybe will have variance, specifically the insulin, the patients treated by insulin, this is a non-applicable diet for them, because if they do delay their meal until if they take an insulin dose and delay the meal, this is very dangerous and they can go into hypo. But however, the non-insulin treated patients with also high blood sugar readings, also not advisable, because some patients may be having variance in the blood sugar and they will restrict the diet or the food for longer time, and then they will eat immediately. This is not good for the blood sugar. But if the patient is diabetic and obese with variance but not very high blood sugar readings, this can be helpful, specifically if we restrict the food like to 12 hours, 8 to 16 hours. This is the maximum or the best method of intermittent fasting, and it cannot have very high bad effects on their outcomes. Yet the patient can have better blood sugar, and they can eventually help in losing weight and affecting the blood sugar readings.
That was answered like a true expert. That was just the answer I was looking for. Intermittent fasting is excellent, but it has its own implications when it comes to variability of blood sugar. That was answered like a true champion of knowledge. Well done, Ruba. Thank you so much. Now, we have another question here, a series of questions, as a matter of fact, from Veena and others. Broadly speaking, talking about fruit and its relationship with diabetes, if at all, in terms of a diabetic diet, and also the benefits or detriments per se of fruit juice as opposed to the whole fruit when it comes to the diabetic.
Okay, now first we know that fruits, regardless it is fresh fruits or juices, it is sugar. This is the first impact on the diet itself. If we want to follow a proper diet, healthy diet in general, not only diabetic, we need to limit the sugar itself. It means that according to the body needs, we need to count and calculate how much we can take in a day. Now, fruits, as I said, it is, although it is sugar, healthy sugar, it is still simple sugar that influence the blood and give us high readings, specifically the juices. We have a method that we refer to, as we mentioned, it's glycemic index. That means how likely the food that we consume increase our blood sugar. So some certain food, including fruits and juices, it has a high value of glycemic index. So when we consume such food, immediately our blood sugar will raise up. So we tend to advise our patients to avoid such food, specifically the fruit juices. However, where we can refer to fruit juices, even if it is fresh, because the value of the fruits get less, and we tend to lose the fiber. So it is, let's say a cup of orange juice requires minimum 3 oranges. So this is triple the calories, triple the sugar, plus we lose the fiber in that. And we are consuming sugar and in a liquid form that immediately get absorbed to our body and end up in a very high blood sugar. So fruit juices, actually, it is forbidden for diabetic patients, specifically the patients with very high readings. On the other hand, where we actually tend to advise for fruit juice, because it is acting immediately if the patient goes into hypo or very low blood sugar and dose or insulin regimen. On the other hand, fruits in general are calculated according to the method of exchange. So yes, still diabetic patient can have fruits, okay, but within the calculated amount, the amount of exchanges per day, they can refer to it as a carbohydrate exchange, which is calculated from their total intake. Plus, they can be smart and wise in choosing the fruits that has the lowest sugar amount and the lowest glycemic index. Some of these fruits are the berries family, kiwi, apple, pear, and we need to avoid, on the other hand, the high glycemic index or the highest in blood sugar, like mangoes and bananas, and on top, the dried fruits and the juices. But again, it can be considered as a serving. So if patient from time to time wish to have a fruit juice, half cup is equivalent of fruit juice, half cup is equivalent to 1 serving of carbohydrates or 1 serving of fruits itself. So this can be calculated into the total amount that they are consuming in a day.
That's lovely, Ruba. And at any rate, all Ruba's answers are going to remain on our system for the next 3 months. So if you'd like to refer back to those answers of the correlation between fruit juices and your blood sugar, please feel free to do so. Now, here is a rather specific question from Sapna. And Sapna says that my fasting blood sugar in the morning is in the region of 120 or 130. Should I persist with my intermittent fasting, or would I be at risk?
This
at the same time, I believe I've read earlier that Sapna is probably on diabetic medication, glucophage, or some such treatment. So if an individual is taking diabetic treatment, has a fasting blood sugar at about 120 or 130, would you suggest that they continue with the intermittent fasting?
She can do that as long as there is no variation in the blood sugar. And if she's only on the glucophage or non-insulin medication, she just need to make sure that with taking the glucophage is closer to the meal time. She will not take it like and leave a gap between her meal time, and few days it will give her an outcome, and she will see if she is feeling fatigue, any weakness, shivering, palpitation. This means that it is not suiting her body. But as her values and her output, I can say she can follow intermittent fasting, but not for a very prolonged time.
Thank you, Ruba. Here is a question that is different from all the other questions. And the question is, the individual suffers from diabetes and feels very fatigued the whole day. What would your dietary advice, or what would your advice be to an individual with this problem, diabetic and feeling fatigued?
First of all, we need to rule out any other cause of fatigue. If the patient is feeling fatigue because of other illness, hidden illness, maybe it could be due to infection, it could be due to other morbidities, maybe the patient is not sleeping well or under stress, let's say of work or examination, then we need to have a proper readings of blood sugar to make sure throughout the day where the variation is happening. And if it is majority of the readings are giving us high, this could be one of the reasons, or very low blood sugar, and it could be another reason. Then we need to see the actual cause of this. What is causing the high readings? Again, we need to look into the diet, the habits in general, any specific, anything like he's focusing on any food groups that he's neglecting in the food group. As I mentioned, if it is unbalanced, if he's on the higher range of carbohydrate intake, this means that, of course, he will feel fatigue because it will directly affect to the blood sugar release, postprandial blood sugar throughout the day. So we need to look into all these factors and see if he is actually also taking his intake needed recommended amount or not. Sometimes this could be a reason. And another very important factor is hydration. The patient could be highly dehydrated, or it could be not drinking enough water specifically.
Can you imagine? Can you imagine? What a beautiful answer. Thank you so much. Hydration. I would never have thought about that. Well done, Ruba. Thank you so much for your advice. Friends, we could go on, and I can see that the questions keep pouring in, but unfortunately, we have a limitation on time. Nevertheless, I repeat, for the individuals who have not been able to see our previous webinars, that all our webinars are loaded onto our website. So please have a look within the hour or two. You will find Ruba's entire presentation on the site for your reference. Now it is my absolute pleasure to thank all concerned for this webinar, and I would like to start with thanking Ruba. I would normally say thank you to my participants first, And you will forgive me if I thank Ruba first, simply because she has taken away from my mind the confusion about the different aspects of the diabetic diet. A complicated subject presented by Ruba so simply. Thank you so much for your great wisdom, Ruba. Thank you so much.
You're welcome. You're welcome. And thank you everyone for attending.
And our participants, if it was not for you, we would not have the energy to continue on a day-to-day and a week-to-week basis. This webinar was on the topic of diabetes and diet. Our next webinar will be talking about the clinical management of diabetes. Now, Ruba has spoken about the diet. Our next speaker will talk about the medical management of diabetes. And the speaker after that will very likely talk about the exercise correlation and diabetes. These are brilliant webinars. And I am so grateful to the RAC Hospital for making available the opportunity to present these videos. But I would, these webinars, but I would be remiss if I did not thank my colleagues who helped us to organize this event. The information, the IT department, the administration department, and my own colleagues from Arabian Wellness. Thank you one and all, and we will see you next week on Friday the 14th at 2:30 p.m. Please note the change of time. This is 2:30 p.m. We normally have all our webinars from 11 a.m., but next week, due to certain constraints, we will be on at 2:30. But during the course of this week, we will send you all the information to your email inboxes. Gentlemen, ladies, our dear speaker, Ms. Ruba, thank you so much and have a great day.